Cystic fibrosis, CF, is an inherited, genetic, life-threatening disorder that damages the lungs and digestive tract. It is caused by a defective gene that triggers the production of thickened mucus that clogs airways and blocks the secretion of digestive enzymes. People with CF have a mutation in the CFTR gene, which leads to altered function of a protein that controls the movement of salt and water in and out of cells. Cystic fibrosis causes thick, sticky mucus to build up in the lungs, which can lead to serious respiratory problems. The CFTR protein is a channel protein that controls the flow of water and chlorine ions in and out of cells inside the lungs. When the CFTR protein is working correctly, ions freely flow in and out of the cells. However, when the CFTR protein is malfunctioning, these ions cannot flow out of the cell due to a blocked channel. This causes cystic fibrosis, characterized by the buildup of thick mucus in the lungs. Symptoms are progressive and often severe, and they may include breathing problems, recurrent lung infections, poor growth, male infertility, and chronic inflammation of the pancreas, liver, kidneys, and heart. The mucus accumulates in the organs and clogs them, preventing them from doing their jobs correctly. In the lungs, the buildup of mucus can lead to respiratory problems such as irreversible lung damage due to infection, airway blockage which leads to difficulty breathing, chest infections and coughing for large portions of life. The mucus also can block the pancreatic ducts, preventing digestive enzymes from reaching the intestine and leading to malnutrition. The mutations lead to thick mucus being secreted from the glands throughout the body, especially within the lungs, pancreas, liver, intestines, and reproductive system. Treatment options include antibiotics to treat lung infections, airway clearance techniques to help remove mucus from the lungs, and nutrition therapy to ensure adequate intake of calories and nutrients. In some cases, surgery may be needed to clear blocked pancreatic ducts. With appropriate treatment, many people with CF can lead relatively normal lives. If the CFTR gene mutation occurs in the pancreas, however, it can lead to malnutrition and digestive problems such as diarrhea and steatorrhea, fatty, offensive-smelling stool. There is no cure for cystic fibrosis, but treatments are available to help manage the symptoms. Treatment options include antibiotics to treat lung infections, airway clearance techniques to help remove mucus from the lungs, and nutrition therapy to ensure adequate intake of calories and nutrients. In some cases, surgery may be needed to clear blocked pancreatic ducts. Cystic fibrosis can be diagnosed with blood tests, genetic screening, and a procedure known as a sweat chloride test. While there is no cure for cystic fibrosis, there are treatments that can improve both the length and quality of one's life. Halotherapy can help to treat the symptoms to clear mucus caused by cystic fibrosis.